Okay.
Okay, thank you very, very much. Okay, good luck, everybody. I hope everybody had a wonderful Shabbos, a wonderful Shavuos. We're in the period of time known as the Yemei Tashlumim. This is a makeup period of time for people that weren't able to bring their korbanos on Shavuos. So there's a period of time in the days after Shavuos, for a 6-day period of time, people can still bring their korbanos. We're living in a time right now that's basically a time of Tashlumim. Everybody is very much missing our shuls, very much missing all of the activities that we had. And Be'ezras Hashem, this week we hope to begin to a certain extent Yemei Tashlumim by opening up Minyanim, Be'ezras Hashem, if everything continues to go well, starting from Wednesday evening. So this is a very exciting time for all of us where we continue to see Baruch Hashem, very good news from the reports from the local areas, from the hospitals. Baruch Hashem, the numbers continue to stay down. And Be'ezras Hashem, we will hopefully do something that we haven't done for a long time, which is be able to begin to daven with Minyanim this week. And I'll speak a lot about that tonight. But I wanted the people to understand the Yemei Tashlumim is an opportunity to make up for something that we didn't do in time. And many of us have not done certain things during this last 2-3 months period of time, from almost Purim until now. And at the same time, we've done certain things maybe even better. People have found maybe more time to learn Torah. People have found more opportunities to maybe daven better. Despite the fact that we're not in a minyan, people sometimes are able to daven better in their homes because they can spend more time on the davening. They're not pressured in some ways. So what we want to make sure during the Yemei Tashlumim is that we don't lose out on things that we've gained. And when people have, Baruch Hashem, gotten to very good and positive habits, we hope that those good and positive habits will be able to continue as we, Be'ezras Hashem, bring back and start to renew ourselves doing some of the things such as Minyanim that we've missed out so much on. The parsha that we'll be reading this Shabbos also has an interesting expression. It says, Litzvot Tzavah. All the different Levi tribes, Gershon, Kehasim, Merari, they're going, and Litzvot Tzavah, they're going to fight in the battle. And we know that the Levim didn't go out to fight. They weren't part of the army. So the question is, why was this Lashon used, Litzvot Tzavah? So the Mefarshim explain, because we're constantly in a battle with our Yetzer Hara. Everybody has to constantly be aware that the Yetzer Hara is going to do everything possible. And this week, the Yetzer Hara is very nervous. The Yetzer Hara is seeing us possibly getting back to our normal routines to a very small extent. And the Yetzer Hara is going to be out there in full battle. And for some, the Yetzer Hara is going to say, you absolutely must go to minyan. And for others, the Yetzer Hara is going to say, no, you're davening better without a minyan. Minyans are dangerous. How can you go and do this? You're not doing other things, and you're going to go to minyan? So each of us is going to have our own personal battle with the Yetzer Hara this week. So I want to stress what some of the Gedolim have said about this. And I pointed this out at the beginning of the letter that I sent out Erev Shavuos, and it's important, it's kedai to repeat again to everybody. Nobody, absolutely nobody, should feel pressure to go to Minyanim if they're concerned, if they have personal health risks, for whatever the reason they have a concern about this based upon age, based upon underlying medical problems that they may have, based upon any factor. But at the same time, there are some people, they're going to say, well, I'm pretty comfortable now not going to minyan. I always used to go to minyan, but I think I'm davening better right now. Maybe I won't go to minyan. And each of us is going to be faced with that battle. The Yetzer Hara is going to be telling some people, you absolutely have to go to minyan. And the Yetzer Hara is going to be telling other people, you absolutely cannot go to minyan. And each of us has to be litzvot tzavah. We have to go out to battle. We have to go out and fight and make sure that we're doing the right thing. Baruch Hashem. We do hope to be able to start minyanim. The shul is going to be sending out. Many of the shuls in the neighborhood have already started sending out ways that we can begin minyanim from Wednesday and go forward Wednesday evening and then have minyanim. And one of the best eitzos, one of the easiest and simple ways, is for people that live next to each other to make small block minyanim with just the neighbors to your right and to the left, the people across the street, people that are nearby, and have bitzimtzum, exactly 10 people coming to the minyan, arrange beforehand, make WhatsApp groups to have little small pools of minyanim in different areas. They have to be done in an absolutely safe way. People need to understand that in Eretz Yisrael, unfortunately, they opened up society much more. And unfortunately, there have been cases. There are 100 cases now in Eretz Yisrael. Hopefully, it still will be self-contained. But that's exactly what we don't want to see happen. We don't want to see people suddenly giving up all the rules and the strict things that they've been doing. And unfortunately, Rahman al-Islam, we should see a recurrence. Will we see a recurrence? Everybody asks me. The answer is nobody knows. Anybody that tells you we will see a recurrence or we won't see a recurrence is flipping a coin. The greatest medical experts cannot, with the information that we have today, not based upon this illness, not based upon any other illnesses. You can't use what happened with the Spanish flu. You can't use what happened with the H1N1 outbreak. You can't use what happened with SARS. You can't use what happened with MERS. COVID-19 is a separate illness. And while there are similarities and there are possibilities that there could be recurrences, there's no guarantee that there will or will not be a recurrence. And therefore, we have to do everything in our power to maximize that there won't be a recurrence. That means we have to take gradual baby steps as we open up society. Long Island opened up this week. Every county, every region in the state, with the exception of New York City, has opened up, and the governor has announced that New York City will probably be opening up next week. So we're getting very close to the entire state being open. Surrounding states and Jewish regions around us, some are already open and some are opening up as well. This is a great opportunity for us to serve HaKadosh Baruch Hu again in ways that we've been restricted. But it is also an opportunity, unfortunately, for COVID-19 to make a resurgence and a comeback. And unless we are careful and unless we take small steps and not jump ahead, we will, Rahman al-Islam, put ourselves at risk. So the way that we have to do this is, again, we shouldn't be having 20, 30 people at a minyan. It's comfortable. Oh, the whole block will get together. You have to make 2 minyanim. If the block has only 18 people or there are only 18 people interested, then don't make one big minyan of 18. Bring in people from someplace else to have 2 smaller minyanim. We normally say, Birov Am Hadras Melech. It's great to have, for HaKadosh Baruch Hu, a larger minyan. There are halachas about Birov Am Hadras Melech. Here, the halacha is that we have to follow the guidelines that the poskim have set up, which is that we should make smaller minyanim. We should not make large minyanim at this point in time. The people attending these minyanim have to be wearing a mask. They have to be socially distanced. They have to be done in a way that nobody is putting anybody else at risk. I cannot stress enough, nobody should even have a thought of going to a minyan if they're not feeling perfectly well. If you have even the slightest sensation that you don't feel well, we all know we've gone to work, we've all gone to minyanim in the past. We do many things when we don't feel tip-top shape. We're at 90%. Something in the background is telling us we're just not perfect. A person like that is forbidden to go to a minyan, whether he has yard site that day, whether he's in the Yud Aleph Chodesh and he's saying Kaddish Rahman al-Islam, whether he's a person that really wants to go to minyan, it is asur. The word is asur. It's forbidden for a person to go to a minyan in that situation. You are absolutely not allowed to go and try to improve your own personal spirituality at the expense of anybody else. I can't stress this enough. A Maisa Shahaya, I put it into the Erev Shavuos little note that I put out. It wasn't so little, it was a long note. But I have to repeat it again. I apologize, but in case even one person didn't see it, it's kedai to repeat. And that is that a Maisa Shahaya, a frum doctor, an Elich, a frum doctor, a person who really understands what's going on with COVID-19 told me this story. That he had a patient who converted, became COVID positive. And he asked him where he's been. He said he's been in minyan. He's a chiyuv. He's a person that was in the Yud Aleph Chodesh still for his parent to say Kaddish. And he said, of course I have to go to minyan. He didn't feel well. He said, I'm a chiyuv. I'm obligated. Chiyuv means obligated to go to minyan. And now, not only was he not a chiyuv, he wasn't allowed to go. It was asur, prohibited for him to go. Now has the problem that he exposed all the other people at the minyan potentially. But he didn't want the doctor to tell them. He said, they'll be mad at me. They'll kill me. But he wasn't concerned that he could be killing them. COVID-19, we nebuch in our neighborhood see and know is a fatal illness for some people. You have no right, if you're at all not feeling well, even if it's, quote, just the headache, I just feel schwach, I feel a little fatigued or weak, you have no halachic right to go to minyan. Your davening is a toeva, it's an abomination in that situation. It is going to hurt, Rahman al-Islam, potentially somebody else. If we all stick to those guidelines and we socially distance, wear masks, spread out, people say 6 feet. There's no magic number in 6 feet. If you can be 8 or 10 feet away, that's even better, especially as people daven. When you talk, you're potentially putting out virus more than when you're just breathing. Certainly if you're singing, if you're davening out loud, there's more of a potential that virus could be spread more than the, quote, 6 feet. So masks are essential. Normally you don't need a mask outside, but if you're having a conversation 6 feet away from somebody else, I definitely would wear a mask. Especially in a situation with davening where you may be davening for a long period of time out loud. And it's essential that we make the davening as safe as possible. This period of time now, when we're opening up stores on Long Island, we're opening up businesses a little bit on Long Island. Not fully, it's an early stage. There are later stages, phases that will still be coming. But this is exactly why it's critical that we have an early warning system to look and detect, are we having new cases in our community? And I'm working with Hatzalah to try to figure out the best way that we can do this. I certainly would encourage any healthcare worker, any doctor, any urgent care provider, anybody who's seeing patients and has new cases of COVID in their practice, to please email me. Let Hatzalah know. We need to have a tremendous sensitivity to new cases in the community. We'll know in the hospital who gets admitted. We have those numbers. We know that every day. But till somebody goes from the time that Rahman al-Islam, they acquire COVID, until the time that they actually get brought to the hospital and get admitted to the hospital, could be a period of a week or two. It could even be 3 weeks sometimes. So we won't be as sensitive if we just use the hospitals as a mechanism to define who has COVID. Is COVID in our neighborhood, in our communities? Even Hatzalah calls. Hatzalah only gets called for people that are somewhat sick. So they're not going to be the earliest detection system. The earliest detection system is when somebody doesn't feel well and they go to their doctor and their doctor diagnoses COVID through a test. And that patient is sent home. The patient can, Baruch Hashem, stay at home. They can be monitored at home. But we need to be able to capture all of those cases in some sort of a central repository. So I'm asking all the physicians on the call, anybody who knows of a case of COVID should either email me or we'll work out a system whereby they can let Hatzalah know. And this way we can have our hands literally on the pulse and know when we have 2, 3, 4, 5 cases in our community that we need to know this information. It's critically important. And as we do open up Minyanim, and as we do open up society, we have to be careful. And all of the rules of maximal social distancing still apply. The governor has said that you can't go into certain stores. If the stores don't allow you to go in without a mask, they have the legal right to do so. We shouldn't need a law to tell a store that they shouldn't let somebody in with a mask. Nobody should have a havamina. Nobody should have a thought that they would be entering into a store, going into any public place without wearing a mask. Any mask is fine. A kerchief over your face, a scarf over your face and nose is also probably just as good for that. But certainly any mask is fine. I don't like the masks that are like a valve mask that the air that you're breathing is pushed out to everybody else. I think those masks are possibly dangerous. But the critical thing is that when you're talking, when you're coughing, chas v'shalom, when you're expelling your air from your body, it should be blocked by something. And that will serve to a large extent to prevent even an asymptomatic person, a person who has no symptoms at all, from potentially spreading virus to someone else. This is a very, very important mechanism that if we'd known about this 3 months ago, I don't know how many lives would have been saved. A terrible mistake was made when the decision was made not to recommend for people to put on masks. This was the CDC's decision. This was the recommendation from all of the experts. And we just didn't understand. And now we do understand that the physical blocking of virus coming out of your mouth, it won't spread as far, it won't be in as high numbers if you block it with some sort of a cloth mask. Sometimes the cloth masks are more comfortable than the surgical masks. And everybody needs to wear a mask when they're going into any area where there are other people. If you're in close proximity, you should be wearing a mask when you're near other people, especially if you're spending any period of time. Again, as I said, if you're walking and you're waving to somebody and stopping to say hello from 10 feet away, you don't need to wear a mask. But if you're having a conversation, if you're sitting near other people, you should distance yourself and you should ideally wear a mask, even if you're 6 feet away. It will be safer. I wanted to address a couple of other questions. The shul will be sending out details about minyanim besides the block minyanim that people should try to arrange. And Yitz Hashem, the administration will be sending something out probably tomorrow. We have a plan for a number of different things. We want to finalize that before we send it all out. There'll be a message going out from all the rabbanim as well regarding some of the things that I've been talking about tonight in terms of making the minyanim safe. Please, everybody needs to read those and follow them very carefully. I heard appalling reports of people making kiddushes already after davening, of people having shalashudises in shul. These things are absolutely dangerous. If we want to go back to having tefillah b'tzibur, we don't want to ruin it by people unfortunately doing things that we're not ready for yet at this point in time. And that brings me to a question that I've been asked so many times, and I know we keep on addressing it, but it's important that people know exactly what the current state of the art is. And that is people with antibodies. So I've been telling that not all antibodies were created equal, and some of the antibody tests are garbage. Most of the tests that are now being done are good tests. They have high specificity. The CDC came out this week and said, if the test doesn't have 99.5 specificity, you shouldn't use it. So some of the early pinprick tests that people would get an answer right away, most of those were 90%, 95% specificity. And anybody that had those tests should not assume that they do or do not have antibodies based upon those tests. They were lousy tests. But the people that have been getting a blood test, a real blood test, and sent off to a laboratory, most of those laboratories, I can't say all of them, but certainly in the recent weeks or week 2 or 3, most of those laboratory tests are in fact good tests. And if you have antibodies, it doesn't mean that you're immune. It's a wonderful thing to have antibodies. It possibly means that you're immune. But again, the CDC official pronouncement this week was, we still don't know. From a psak point of view, we don't have the right to ignore the CDC opinion, even if I may disagree with it. I do think that antibodies have value. I do think that we will, in Yirtz Hashem, be able to say that if this person does have antibodies, they're not going to get COVID, at least in the near future. But the CDC is not willing to make that statement now. And when it comes to pikuach nefashos, we have to go by the biggest mumche, by the biggest expert. And you can't just blithely ignore the CDC opinion, even though they have been wrong. And even though various individuals say that you're protected if you have antibody. It is irresponsible at this point in time from psak halacha to tell people with antibody that they can do whatever they want to. They will not get COVID. It is irresponsible to say that. It may be right. It may, in fact, be right. But to say that as a psak for a community, especially when some people got antibodies from weeks ago and they don't really represent that those are true antibody positive tests. And also some of those people were truly positive from antibodies from exposures back in February. And we don't know whether those antibodies still will carry through and make them exempt from catching COVID in the summer. So we don't know if that's true or not. So we still need to find more about that. And therefore, from a psak halacha point of view, a posek has to take into account the CDC opinion, even though it may not be 100% correct, but it's a cautious opinion. And therefore, I personally only at this point use antibody to help decide on very specific cases where people have a need to go and come together with another family for whatever the reason. And if they have antibody, it makes me able to make a decision a little bit more easily in that particular case. But we can't at this point in time make broad global statements about the community regarding antibodies. And therefore, in Yetz Hashem, maybe in a week or two, as we open up and we see Be'ezras Hashem that there aren't a lot of new cases, Be'ezras Hashem, maybe then we can start saying that more mixing can be done. Maybe those grandparents will finally be able to hug those little grandchildren who we miss so much. But not yet. Maybe soon. But as we open up both Long Island from a secular point of view, and as we open up the Minyanim, this will be a test. This will be a chance for us to see, is it safe? And then we can move on to the next step, which maybe is a little bit more mixing in a very careful and gradual fashion. But a lot of things have been going on, and we have to make sure that we do it safely. If we take too many steps at the same time, it could unfortunately backfire, and we could be back into the position where we have to go back into real isolation when that might not have been necessary if we could find out what is causing the problem and nipping it in the bud. I've been asked a ton of times about shopping. It is safe to go shopping as appropriate still for food in the ways that we've talked about, with a mask, trying not to go as often as you previously did, but trying to make one big shopping. The same rules still apply. As other stores are now opening up, I think it's safe to use the stores that are open in the proper legal way, and a person should, as much as possible, make sure that they go and do all of the things that are required both by law and good medical practice and common sense, and not take unnecessary chances. If it's not legal, then don't do it. But at the same time, it's very important that we patronize the stores that are struggling. We try to do as much business with them as we can, because the stores are struggling. And if they're opening up, and they're opening up in a legal way, and they're opening up in a way that you can patronize those stores, we do recommend that people go and use those stores. Again, when you're picking up your packages or going into the stores as allowed, make sure you're wearing a mask and socially distance as possible. I get a lot of questions about still, do you need to wipe down stuff? So the answer is, I don't think you need to wipe down packages that come in, the mail that comes in. You open it up. If you want to, wash your hands afterwards. You put away your packages, wash your hands afterwards. I don't think we need to go crazy. I put out a lot of information about swimming pools. That's the other area that I get most of the questions. Please read the Erev Shavuos notes that I put out, which were quite detailed and gave all of the CDC recommendations. I get a lot of questions about camps. I think that there's still a lot of discussion about both sleepaway camps, some of which have stated that they're going to be open, some have stated that they're going to be closed, and day camps. There are a number of day camps that are trying to open up. It is too early to say whether the state will allow them to. It is too early to give recommendations at this point in time. And I think we unfortunately are in a position where we just have to wait and see what will happen in the next couple of weeks, and then whether the camps will be able to make a decision to open up and whether they'll be allowed to open up. I think they can be opened up in a safe way, or at least in a somewhat safe way, but that will depend on what happens in the next week or two as we start opening up the society. Finally, the last thing that I wanted to address is people are constantly asking, is it safe to go and start mixing? So I think probably by next week, we'll have a little bit more information with society being open that will be able to start expanding the bubbles that we've been talking about. And maybe families that have been totally isolated will be able to start picking one or two families to mix with, and only those families. This is actually outlined in the Aguda guidelines, and there are, I think, sound medical reasons why this can be done in a safe way, as long as there aren't really significant numbers of new cases in our neighborhoods. It will have to be done with great caution. I would not do it yet this week, but maybe, Amir Hashem, we can talk about doing it next week when we see how things are going. But it all will depend on how things are going. Everybody needs to read the information that the shul will be sending out, and the Ezras Hashem will be able to go and begin this opening up in a safe sort of a way, both for the minyanim as well as for the businesses. Is Rev Shmuel Wagner on the call?
Yes, I am.
Okay, so I think first of all, I want to thank the shul's administration. They've been doing just such a wonderful job, and Reb Shmuel Wagner leading the shul administration, along with Ari Schulman and Josh Coulter as the chairman of the board, have just been doing such a tremendous job with Rabbi Danny Frankel and Mindy Glicksman and all of the staff of the shul that have been working as volunteers. They deserve a tremendous amount of credit. So Rav Shmuel has graciously agreed to look through the chat questions, and if I haven't addressed anything, he'll ask those questions to me now, and I'll try to answer them.
Okay, a question came in. The question is as follows. The family branches are sharing a swimming pool. How and what needs to be cleaned around the pool and chairs to make it safe? And the underlying assumption is that it is safe to begin with to share that swimming pool, so that should be addressed.
Okay, so I did put out in great detail the CDC guidelines for how one can use a pool area. Now, the CDC guidelines are actually much looser than what I would choose at this point in time. And while we're not allowed to be more makel than the CDC guidelines, I think we can be more machmir. I'm not ready yet to say that you can have multiple families in a pool. You can have only people from one family unit. Now, if your family unit is, a grandparent, children, and grandchildren, and they're all living in the same house, so then they can all use the pool all together at the same time. But now they want to let somebody else use the pool. So somebody else can use the pool when they're not in it. Only one family unit at a time, I would recommend using a pool right now. It doesn't have to be the same family unit. It could be a different family unit using the pool, but there has to be cleaning in between. They have to wipe down all the high touch areas. So if there are railings or other areas that people are going to touch, they should be wiped down. I also recommend people go to the bathroom before they go to the pool, and if they're old enough and it's not a problem, they hopefully can go swimming and then go back to their houses and use the bathroom again. Bathrooms are a potential of concern in that people who have virus have potentially virus in their stool, have virus in bathrooms where people had virus, so you can isolate virus throughout the bathrooms, and therefore I would suggest, as possible, that the bathroom not be used. If the bathroom does have to be used, the bathroom has to be cleaned in between usage, because again, it is a potential area for spread. In the hospitals, we spend a tremendous amount of time in between patients, making sure that the rooms are clean, and we focus a lot on the bathrooms in between patients. So in a pool area, I would likewise recommend that only one family unit use the pool at a time. You wait some period of time afterwards, probably a half an hour is more than enough, and then the next family unit can come in using the pool, but it has to be cleaned or wiped down, the high touch areas in between, and certainly there should be no sharing of towels. Bring your own towels, and if they're toys, noodles, and all sorts of boards, probably they should be either wiped down or each family should just bring their own. But in this way, if somebody, Baruch Hashem, does have a pool and they wish to let other people use it, I think it can be done in a safe way. Again, in the email that I sent out Erev Shabbos, I gave great detail about this.
Okay, the next question is, when is it realistic to hope for a vaccine to be available for the population, and when will it be reasonable to expect to be able to travel to Eretz Israel?
Okay, two very, very important questions. The vaccine is all conjecture still at this point. Anybody that tells you the vaccine will be here in 2020, or even if they say 2021, they don't know what they're talking about. Nobody knows. We have to admit, the famous Rashi in the Gemara, it says, Lo yadati, I don't know. It's right now in the Daf Yomi, we have this Rashi. Lo yadati means I don't know. It's okay to say I don't know. Nobody knows when we'll have a vaccine. The earliest we could have a vaccine would be towards the end of the year. And Baruch Hashem, there are many, many companies working on vaccines. There are probably 100 vaccine candidates, which is wonderful. But it doesn't mean that any of them are going to be here tomorrow. It doesn't mean any of them will be successful. Mirz Hashem, there are, at the very preliminary early stages, there have been some candidates that are moving on to the next stage, which is fantastic. But they need to be mass produced in a safe and efficient way. They need to be absolutely protective. We know nothing about that yet. All we know is that some of them have been able to generate an antibody response. That doesn't mean they're safe. It doesn't mean that antibody response will be protective. It doesn't mean the vaccine will be able to be mass produced. It doesn't mean the vaccine will not have side effects. So all of those need to be done. And B'ezras Hashem, we will have one, but nobody can even guarantee that. And when we'll have it, it will be totally something that we won't know for months before we even get an inkling that we have a successful vaccine. In terms of flights to Eretz Yisrael, so besides the availability of such flights, Israel is supposedly going to be letting in flights starting in July, I believe. But assuming that you're not an Israeli citizen and you are able to go there, they will probably still want to quarantine you, which is going to be obviously difficult if somebody's going for a 7-day trip, and to be quarantined for 2 weeks, you're not going to have much of a trip. So there are quarantine issues. Assuming there are no quarantine issues, assuming that it's able for a person to go, the question is, how safe will air travel be? And that will depend on what the incidence is of infection in the area that you're traveling from. If you're traveling from the New York area and B'ezras Hashem in the summer months, there isn't a lot of COVID around, so then B'ezras Hashem, air travel will be safer. It still will never be perfectly safe. You're spending a trip to Eretz Yisrael 10, 12 hours together in an enclosed area, so that is a risk. It will always be a risk if there's any potential for any viral infection. And certainly if there's anybody with COVID-19 on that plane who's asymptomatic, they could be shedding virus and it could be a problem. So I don't know when we'll ever be able to say it's absolutely safe to go back on a plane anywhere, not only to Eretz Yisrael, but that will depend, the safety will depend greatly on some of the screening measures that are used. If nobody goes on the plane that's sick and they can screen for that, that will decrease the incidence of anybody actively sick, but it won't do anything for asymptomatic transmission. But if the incidence of asymptomatic transmission is lower, so there's less people with COVID, so then that incidence will be lower. And if everybody wears a mask on the plane, that will further decrease it. And if we minimize, if they spread out the people on the plane a little bit, so all of these things are potential ways to decrease the likelihood of getting sick on the plane.
What does Rabbi Glatt think about whether children are able to pass coronavirus to adults based on no evidence seen of children passing it by the WHO? And Rabbi Glatt also, one person asked, how do they receive your newsletters if they're not members of the Young Israel of Woodmere? So from the administration point of view, I say become members of the Young Israel of Woodmere. You can tell them how they could get, even if they're not members.
So I don't know if we can put it on the website, Rav Shmuel. Maybe that's a possibility. It is sent out to many of the rabbis in the community that have asked me to. They're welcome to send it out to their shul members, or ask somebody who is a member of the shul to please forward it to you. That's the easiest way. In terms of the WHO paper or study that said that children don't transmit it, I discussed that several weeks ago. There's been absolutely nothing since then. Obviously, I think it's clear to everybody that children can transmit it, because unfortunately we have children with serious illness, and we have children that have transmitted it, so it clearly can be transmitted from children to adults and from adults to children. In children, Baruch Hashem, there is a lower level of virus. That has been shown. So while there may be more children getting it, children probably are asymptomatic more often than adults. In some studies, it's up to 40% of the children are asymptomatic, but they do shed virus. So that's an unknown how contagious children are. And that has huge ramifications for camps, day camps, as well as sleepaway camps. So I think it's safe to say that children can transmit virus. It's a question of how effectively they transmit it, how often they transmit it, and are they going to be as contagious as an adult? So I think the answer to some of those questions is no, children are not as infectious, not as contagious, but they still are contagious. And certainly it is very dangerous for anybody with virus to be around people that haven't had COVID. And Rahman al-Islan, that could be a fatal infection that a child could transmit.
Let me ask you two questions. One is, do you have any recommendations for use in the Long Island Railroad and or the New York City subway? And is shidduch dating permissible at this point in time?
Okay, two, again, excellent questions. So in terms of using public transportation, as best as possible, I think the subways themselves are not a cause of picking up COVID from the seats or from the railings. but I would suggest that people not touch anything that they don't have to in the subways or on the LIRR, and wash their hands, Purell them when you leave the subway. The real risk is other people on the subway. If you wear a mask on the subway and everybody else is wearing a mask on the subway, and that's possible, there are less people going to work, there are different numbers that are not packed in like they were during rush hour on a normal day. So if you're able to somewhat socially distance and you're wearing a mask, I think that it's not unreasonable to use the subway. If the subways are going to be packed and crowded during rush hour, and some of the people aren't wearing a mask, I think that's an unsafe situation. Did I miss a question, Reb Shmuel?
Shidduch.
Oh, shidduch, yes.
Some young man wants to know whether you can start shidduch dating.
So we strongly recommend that people start shidduch dating. YU Connects has been putting on wonderful Zoom shidduch dating opportunities for larger groups, and then they, Baruch Hashem, they pair off, and they've seen a number of very, very nice connections already, and many others as well. But we do recommend, under the guidance of a village shlita, that the first dates still be done, the initial dating still be done via Zoom or technology, and when the dates reach the point where it needs to move to the next step, then I think there are acceptable ways for the couple to be in the same vicinity, still socially distancing to a certain extent. And when the Baruch Hashem, it reaches a point where it needs to go even the level beyond that, then there are potentially opportunities for them to bring the relationship even closer without the same amount of social distancing. But again, it all depends on other factors. Who are they living with? If they're by themselves, they're older and they have their own apartments and they're not living with older parents or older grandparents, so then there's less risk. It can't be answered in a general way. These things should be discussed with a Rav and with a professional, a healthcare professional that can help address at what point in time what things might be permissible. But at the beginning, we are recommending that shidduchim still go on, absolutely. People should be trying to make shidduchim as much as they possibly can, and the first dates should be via Zoom or technology of that nature.
Somebody wants to know how they can get hydrochloroquine available for people who need it when the WHO doesn't agree with it. And while you're on that, could you address whether there's any updates on taking Advil versus Tylenol, somebody who's not feeling well?
Okay, so I don't think there ever was any evidence that Advil was safer or more dangerous than Tylenol. The same underlying risks with Tylenol and Advil and all the non-steroidal agents are probably true for COVID as they are for non-COVID, and people shouldn't be taking either of those products unless they're supposed to and have a reason to, and then they should be taking it based upon their own personal risk factors. Some people it's more dangerous to take Tylenol, some people it's more dangerous to take non-steroidal agents like Advil or agents like that, and I don't think COVID has anything to do with it. Nobody, I stress that. I gave a share on this last week. I think it's usher for a person to take hydroxychloroquine right now for treatment of COVID, especially if they've had it for a number of days. The studies suggest it's actually dangerous, and a person is not allowed to take a dangerous medication. So I would think it's usher for anybody to be taking. We no longer recommend it be prescribed in the hospital. I took it off the physician's ability to go and prescribe it for COVID. They can still prescribe it, of course, if a person has a rheumatoid arthritis, if a person has lupus, a person has another reason why they should be taking hydroxychloroquine. It's a fine drug. The person needs it for malaria. It's a fine drug. They should absolutely not be taking hydroxychloroquine for COVID. It is dangerous. Studies have shown there's a higher mortality. There are 2 studies still underway. And if you're entering a study, you have the halachic right to enter a study. One is for prophylaxis, to prevent COVID. We have no evidence to suggest that hydroxychloroquine can prevent COVID. But there is a study underway, which we don't know yet the results of, where they're looking at people taking COVID versus people not taking COVID, and they've been exposed, healthcare workers, to COVID to see whether it's of any benefit. So you shouldn't be doing this outside of a study setting. And even if somebody gets COVID today, there is a study underway whether early treatment with hydroxychloroquine has any benefit. And that's also unknown. And therefore, from a halachic point of view, I think it's forbidden for somebody to take hydroxychloroquine at this point in time. Clearly, It is dangerous in many patients and shouldn't be done outside of a study setting at this point in time. Maybe Reb Shmuel will take one more question.
Okay, last question is there any age over which one should not attend minyan, even if they're feeling well?
So this is a question that I asked the various poskim. None of the poskim that I spoke with were willing to come out with an age or an absolute statement saying it's usher for somebody to go. Many of the poskim said you highly should recommend that they do not attend if they have significant risk factors. Age is a specific risk factor. I cannot tell people a specific age that's a risk factor. Nebuch, we've seen 40-year-olds die in the hospital. We've seen 10-year-old kids, 15-year-old kids get significant complications of COVID. The older you are, the higher the risk. The more risk factors you have, the higher the risk, obviously. And anybody who has any concern, even if they're 40 years old, and they have any risk factors, or they're just afraid, they shouldn't be going to minyan. But if the minyan is safe, if the minyan is conducted properly, people are 10, 12 feet apart outdoors, everyone's wearing a mask. So I don't think that falls into any halachic guideline where it's forbidden for somebody to go. But I stress, Rosh Shlita said he's not going to be going to minyan. Nobody has to be holier than Rav Shechter Shlita. If Rav Shechter says he's not going to minyan, then anybody who has any concern about going to minyan shouldn't feel the slightest halachic or peer or social pressure of any sort to go to minyan. Even if you're the 10th guy, that minyan won't occur that day. If you're afraid to go, they won't have a center. They won't have a 10th person. And that's halachically appropriate for all 10. And nobody should feel pressure to go to minyan. And I get a lot of calls about this. If you are concerned about it, don't go. On the other hand, if it's done properly, there's spacing, there's masks, it's done outdoors or indoors under the proper conditions, and you think you can, you see everybody's doing it safely, and you want to go to minyan, and you're not at a very high risk, so I don't think it's also to go. It still may not be recommended, but I don't think you can say that it's also for such a person to go. But everybody should leave the minyan the minute it becomes an unsafe situation. And people have told me, these minyanim, they start off at the beginning, okay, and by the end, everybody's congregating, and then somebody brings out some schnapps and cookies. These things are terrible. You take off your mask and you're eating. That's the best way to make sure that there won't be a minyan next week. So I beg people, concerned or scared, if you do go to minyan, only go to a minyan that's acting properly and leave immediately. I don't care if you're the 10th guy. If they're all starting to congregate, take off the mask because they can't hear so well, it's uncomfortable, it's too hot, leave the minyan. So they won't have a minyan. They'll yell at you. Don't feel bad about that. If the minyan's not being done properly, leave the minyan and don't go there again. But if a minyan's being done properly and everything is done, so Tefillah B'tzibur is a wonderful thing. Yezuz Hashem will send out stuff from the shul tomorrow to tell people what the shul will be doing. People should be already arranging block minyanim as possible to daven outside. Nobody should be davening inside in an unsafe area. I don't care if it starts raining, anything happens, so then there's no minyan. Nobody should be doing anything that's dangerous. That is the worst thing that we could possibly do, both in the eyes of HaKadosh Baruch Hu and from a medical point of view. We took a lot of time up tonight, more than usual. We did start a little bit late. I apologize. Mitzvah Hashem, I hope everybody has a good vach. We should use these, use them in a very healthy and safe way. And in Mitzvah Hashem, our tefillos that will start going on the last day of the Yemei Tashlumim, they should be a wonderful tashlum. They should be a wonderful replacement for all the tefillos b'tzibur that we missed. Mitzvah Hashem, have a wonderful week. Good vach.
Oh, thank you.